So health hazards related to air pollution could be acute effect and the chronic effect. Currently what we are seeing because of the very high or bad AQI is basically the acute effects, and they can be because of people who have underlying heart or lung disease, or who are older of older age group or younger children. In them we are seeing more of chest discomfort, breathing difficulty, cough. Many patients are feeling chest tightness in the night, and this worsening of the underlying condition. If a person has asthma, COPD, his wheezing or his breathlessness is increasing, they're not able to breathe. Patients with heart disease, their breathlessness again is increasing, heart failure is becoming more. And because of this, there is increasing emergency visits, doctor visits. A study we had done many years ago, which was done at AIIMS, showed that when air quality becomes very bad, in the next 4 to 6 days, there is an increase in emergency visits by people with respiratory problems, both children and adults. So the acute problem that we're going to see is because of this. The other thing is that even healthy people who don't have underlying disease are also experiencing stuffiness of the nose, pain in the throat, chest tightness and coughing because of the high effects of air pollution, because this pollutant is, when it goes into the lung, it causes airways to become inflamed and narrowed and leads to breathing difficulty. Some people complain of wheezing, and these are people who have never had any chest problems or who have come from outside to Delhi for work and have now started having problems. So I think for the last few years one has been very strict about allowing crackers because of the fact that they also add on to air pollution. There are multiple factors which come into play. One is weather related and the other is the emission related. So if you look at emissions, then crackers are a factor which is emission related, and with the large number of crackers being burned because there was permission given, and then obviously we know that if permission is given then it doesn't become green or non-green. All types of crackers are used, and there was no control as far as that was concerned. And also the weather was such that there was less wind and all the pollutants stayed at ground level, and that was also worsened the quality of air. So I would say the first thing is people who have respiratory problem, who have heart problems, the elderly and children should monitor the AQI, see what the AQI is in their area, and avoid going out early in the morning and late in the evening, because when the weather is cold, because of the cold temperature, air quality, poor air or pollutants tend to stay more at ground level. So once the sun is out, then only go out if you have to go out. If you're going out, you should wear a mask. N95 masks are useful, but some people find it difficult to wear them. But if you can wear them, then go out. When you go out, please wear a mask. Keep yourself well hydrated. Take good amounts of fresh fruits, green leafy vegetables. Avoid exercising early in the morning and late in the evening. And if you have any breathing difficulty, chest congestion, your underlying condition is getting worse, you must consult your doctor so that you can start treatment early rather than having any severe problem and having to come to hospital.
And so for children?
For children also, it becomes even more challenging because children tend to play a lot outside, and when they play they breathe more rapidly, so they inhale more pollutants because their respiratory rate is higher. It's also difficult for children to wear masks. They don't find it that comfortable. So I would say the same thing, that if children are going out to play, they should go out either in the afternoon or avoid going out early in the morning and late in the evening, and to do indoor activities if possible.